Hello, my friends, and welcome back to the podcast. So, today I'm going to teach you one of the powerful strategies that you can use today to start converting more of your consults. As you know, one of the biggest pillars that I teach my clients is 90% plus case conversion, case acceptance, so conversions, 90 to 100%. And so the way I do it for my clients is actually I review their consults. So inside of the mastermind, you every week you can submit a recording of your consult, and I listen to it and I give you detailed feedback. And over and over again, I'm noticing that you folks are doing certain things in consults, not just as one person. It's many women dentists and orthodontists do that. And I used to do this too. By the way, I'm not an ivory tower sitting here. And once I removed that from my language, and once my clients learn to remove that from their language, everything changes. The energy in the room shifts. You become more perceived as a higher authority because that's what will close the consult. It's not how well you explain the treatment plan, which is what most of you are thinking. Most of you are thinking, well, my patients are shopping around and I'm a second opinion and they think I'm too expensive. So I just need to do a really good job explaining them the treatment plan. And so you spend a lot of time going into all of the details, maybe using a ton of analogies. And unfortunately, what you end up doing is you end up confusing your patient. You give them 3 treatment plans, you go into all of the details, and then at the end, the patient just sits with their big eyes and they're like, "Oh, okay, thank you." And then they leave and they talk to your salesperson. And they go, "Oh, doctor was very detailed. I think I need to talk to my husband about it. I need to think about it." So, one powerful thing that I'm going to teach you today, well, from what I just described to you, you probably will uh, take this nugget of not giving too large of an explanation, not spending too much time on the clinical exam, and that's important. But there's another thing that you guys are doing, which probably is just such a habit for so many of you, but we're going to change that on this episode, okay? And exactly what I'm talking about is using diminutive language, okay? Using words like a little, slightly, kind of, maybe, not that bad. Okay, and I'll give you specific examples by specialty. The problem with diminutive language is that it lowers urgency for the patient to sign up for treatment with you. It also lowers the perceived problem because it's just a little crowding. And what it eventually does is it lowers your case acceptance. So you think you're doing everything you can, you're sending your TC to all these trainings, and your conversion is stuck at 60%. The reason why is because you, the doctor, are using diminutive language. But guess what? In today's episode, I'm going to teach you how to turn that around. Okay? So here's what I want you to picture. Imagine you are at a car shop, and there's problems. You're getting your car checked, and there's like a problem with your tire. And the tech says, well, your tire is slightly flat. Does that compel you to throw your credit card at them and say, fix this immediately, if not sooner? No. Instead, if the tech said, your tire is losing air and will fail when you continue driving it, what are you going to do now? You will solve the problem. Do you see where I'm going with this? And unfortunately, you are creating this first situation, your tire is slightly flat, with your using diminutive language in your explanation during your consults. That's what you're creating for the patient. The patient thinks that it's not that big of a deal what she just said, so why should I be paying thousands of dollars for my treatment? So now that you're aware of that, let me give you some examples of how it shows up in different specialties. So inside of my mastermind, I have a lot of orthodontists, and so there's a good chance that you're an orthodontist listening to this. So I'm going to start with that because I'm an orthodontist too. So we're going to start with that. So for orthodontists, you ladies are saying, okay, so there's a little bit of crowding here, or your bite is slightly off. The tooth it's kind of tucked in a little bit. It's leaning in a little bit. Or, it's not too bad. Maybe we can fix it without braces. Notice these like minimizing diminutive language. And I get it. You're talking to children often, but don't forget that mom is the deciding factor, or dad. Most of the time it's mom, right? The power of the purse is with the parent. So you need to be presenting the treatment to the parent. I'm not saying ignore Johnny, involve him too, but mostly talk to the mom. So instead, what you can say is when you're reviewing your records, when you're reviewing pictures, scan, or however you do it, you can say, let's look at the top jaw. Here I see crowding. Even if it's 3 millimeters, it's crowding. Don't call it mild crowding. It's crowding, period. When you call it mild crowding, I know it's called mild crowding, moderate and severe. I'm aware of that. But for the patient, think about the perception of the client, the patient. They hear mild and they don't think it's a big enough problem, right? People don't value teeth as much as you and I do because they haven't spent years carving them out of soap. So for them, it's important, but it's not that important. Your job is to make it urgent and important. And you do this with your language. So you're going to say in your next consult, let's look at your top arch. There is crowding. It is a problem because teeth don't have enough space to come in properly. Okay? And that's also, I should have mentioned that earlier. This is how I want you to reframe this diminutive language. I want you to reframe it as, this is a problem and here's why it matters. Okay? A logical consequence. Don't just say, okay, you have crowding. All right. Is that what's the point of reference? Is that bad? Give me a point of reference, right? Okay, so let's do more examples. Your bite is misaligned. Not your bite is slightly off. Your bite is good here, but it's a little off here. No, your bite is off. Your bite is misaligned. And it's a problem because it's going to wear your teeth over time. So it will need to be addressed. Sometimes you have to slow down to learn to speak this way, but the more you practice, you'll get a hold of it, a hang of it. Okay, maybe you're a general dentist. The way you're using diminutive language would be, there's a tiny cavity here, or we can watch it for now. There's like a little decay. You might need a crown eventually. Instead, I want you to say, there is a decay. It's going to spread, so we need to treat it. Or this tooth is compromised. It needs a crown. More definitive language. Let's look at it. Maybe you're a pediatric dentist. Instead of saying, oh, it's just a baby tooth, we'll keep an eye on it. It's not a big deal right now. No, although it's a baby tooth, this affects how the adult tooth develops, so it needs to be addressed. If you don't address it now, it will be a bigger problem later. That's how we need to start talking about it, okay? If you're a cosmetic dentist, you can say, maybe you're saying things like, yeah, we can touch it up a little bit. There's a little stain here. You can slightly improve your smile. You already have a good smile. We'll just, make it a little bit more handsome. There's just some minor spacing that we can address. I see some minor spacing here. Instead, I want you to say, there is a spacing and it disrupts the harmony of your smile. I know it may not be the way you're normally talking, but let's start practicing saying that. Just practice it when you drive in the car, when you're talking to yourself. Practice how you would present cases. We can fully redesign it to match your facial aesthetics. What I do with my clients is when we get on coaching calls, I literally give them, I just did it with Dr. Carla. We literally got on the call and I pulled up a case, pictures and x-rays, and I said, okay, how would you present this case? What's the phase 1, phase 2, phase 3? Inside of the Conversion Queen and the Mastermind, I teach the 3 phases of a consult that you want to do. And so I had her run through every single phase, literally role play and practice. It is so worth it. It's thousands of dollars on the line. Okay. Maybe if you're a periodontist, let's do more examples. The way you're using diminutive language is you might be saying, you have a little gum recession here, or there's some inflammation. We'll clean it up. Instead, I want you to say, there is gum disease. There's gingival inflammation, period. Pause. You are losing bone around these teeth. Pause. Again, I know it may seem a little dramatic, but your patients need to hear it in order to take action. Okay? So let's summarize what I just taught you in this episode. Next time you're going to a consult, I want you to start paying attention to the actual words you're saying. And listen, here's what's going to happen. This is exactly what's going to happen. You're going to walk in after you've listened to this episode, download the worksheet so you also have the breakdown, like the reminders of how to change, reframe the words that you're using. You're going to listen to it, and then you're going to go into your next consult. You're going to become so self-conscious over your words that you're going to start tripping, and you're going to start sounding like you just finished residency or dental school. That's totally normal. Like I challenge you to embrace this and keep going. You are learning a new skill, but boy, does it pay off. Because that's how you're going to learn to convert your consults at 90 to 100%. Isn't that worth it? So, my friend, next time you have a consult, let's slow down a little bit. Let's present in a new format of this is a problem, pause, here's why it needs correction. And watch your consults convert higher. I'm so excited for you to try this, and I'll see you in the next episode. Bye, y'all.